So what does it mean to separate the eating disorder from my child?
Yeah, that's an interesting technique, and it's been around for some years. It's originally from narrative therapy, a type of family therapy in the 70s that developed in the UK and overseas, but it's been adopted across lots of different disorders, and people might have heard of the black dog and depression, and seeing it externally to the person. So we use that a lot in eating disorders because for two reasons, really. I guess it's really important that kids particularly don't take this on as part of their identity.
Right.
We don't want to call them an anorexic or a bulimic.
Right.
There's somebody with anorexia,
Okay.
which means they can be somebody without anorexia.
Okay.
And if you do that gentle separation but distinctive, it's saying you can recover from this and you can kick anorexia out of the household. The second important part is that parents often come in, at the end of their tether. They've been fighting with their adolescent for some time, it's really stressful. And when you externalize it and see it as something separate from them,
Yes.
you can all join together to kick anorexia out of the household.
Yes, it becomes easier.
Yes. And you name it and you explore with the young person. And they sometimes think, I'm not crazy, I don't have a voice in my head. And I get that,
Yes.
But you can still see it. You might name it as anxiety. What are your anxious thoughts? Or just thoughts, and say, well, what thoughts do you have when you're trying to eat? Young people might be, whilst they might not like the idea of a voice in their head, they might be able to identify the thoughts. So you have, they're able to say that the thoughts are, when they're trying to eat, I'm going to get fat, or I'm a horrible person for eating. And so you can build on that and say, if you had to give that thought a name.
And I suppose as well for a parent, if you can actually, you sort of mentioned that before, but if you can identify that it's sort of the same sort of name, whether it's Voldemort or a name like that, then it just becomes so much easier to sort of
have that discussion.
To have that discussion.
Yes. It's not, and it's
you're doing it together.
Yeah,
sort of
that's
helping.
right.
Yeah.
That's right. And it looks like Voldemort's really at you today. It really looks like Anna's having a good go at you today, and I'm sorry. And be empathetic around that. It's not the young person's fault.
Yeah, that's really. I think it's really important to do that.
And it also means the parents have something to get angry at, not the young person. You get angry at Voldemort. I'm so sick of this eating disorder.
Yeah.
But it's not the young person. I can't wait to get Ruby back, or Mark is going to be well at the end of this, or whoever. So, that actually it gives a focus for their anger, and
it's very helpful.
Yeah.